and children and young people in Halton, Knowsley, St Helens and Warrington who are going through a mental health crisis are being given access to a 24-hour help team for the first time. The new crisis response team is being run by Merseyside NHS Foundation Trust, and it's already seen large numbers of under-18s using it. Lisa Simpson is Clinical Services Manager for Children and Young People's Mental Health at Merseyside. She told our reporter Phil Cooper that the idea for round-the-clock services goes back to 2012.
We know that, unfortunately, probable mental disorder rates have gone up with children and young people over the last few years. So it was a task from NHS England, really, to look at something which is much more comprehensive, much more robust, much more accessible to young people and families. And that's why the CAMS response team was set up. So like you say, it's a 24/7 service. We used to offer emergency assessments within 24 hours, but now that's within 4 hours, and it's 7 days a week. We have a number of different functions: assessment, brief intervention, as well as home treatment, but all designed to keep young people and families in the home for longer, out of acute and out of inpatient services, and make sure they get the right care and treatment when they need it, really.
How does this team actually get in touch or find out about somebody who needs the service? How are they referred to this team?
No problem. So it's professional referral and self-referral. So young people themselves, children and young people, can pick up the phone and contact the team 24/7. They can talk about the crisis that they're currently facing, and then we can almost do a triage call. And then we look to complete that emergency assessment with their carers and their parents. We can also accept professional referrals. So that's your teachers, your GPs, any professional agency that you may come into contact with can refer on that child or young person's behalf for that emergency assessment.
How long has the team been running for now then?
Well, in its new model, we launched in August this year. But before that, like I said at the beginning, it goes back to about 2012. But with the transformation over time, we've had different functions and different offers and different forms. But this new model is our most recent update, and it's brings us in line with that 24/7 access as of this year, really.
So since the new model came into effect in August, what sort of demand have you seen for this team, for this kind of help?
Yeah, we've been getting on average about 300 to 400 referrals per month. We expected to be relatively quiet at first during those kind of 9 p.m. till 9 a.m. time frames, but we have been surprisingly busy, which is fab. And it means that, the word is out there for children, young people to access us. And we're seeing anywhere on average between 2 to 3 young people every evening.
Is that more or less than you expected?
More, definitely more. And because we cover Warrington, Halton, St Helens and Knowsley places, we're quite a big footprint within the trust. So we have quite strong links with our Warrington Hospital and the Western Acute Hospital. So we make sure that, we're very available within that setting as well.
I mean, when you hear some of those figures, around 300 people a month contacting the service, and as you say, quite a few people contacting the service overnight, so the 24-hour element is obviously working. The numbers sound quite shocking, really, in a way. But from your perspective, you're glad that so many people are calling, I imagine, because they're taking those steps to get the help they need.
Yeah, absolutely. I mean, within any crisis, it's self-defined. So, we don't try and label what that crisis is. We don't have any exclusion criteria other than we are a children and young people service, and we function within those 4 places. But, it's really important for us to be available and to be accessible. We know that if young people and families don't feel supported and don't feel they've got the right access when they need it, where they need it, crisis can escalate, and it can often result in admissions to hospital, mental health hospitals, as well as, acute hospitals. But it can also result in family breakdown and lots of other really poor outcomes for children, young people and families. So accessing our service means that we can, get in early, we can support and listen to what that crisis is, we can signpost and we can put in treatment plans and safety plans, and we can, like I say, keep children at home with their families for as long as possible. And ultimately through the crisis, support them through the crisis, through the other end. So, they go on to achieve those kind of clinically better outcomes.
I was going to say, I mean, how important is it that once they've contacted the crisis help team and you've made that initial contact with them and you've helped them, how important is it that they continue to get that support all the way through?
Yeah, it's really important. It's crucial. We look at care planning right from the beginning. Care planning and safety planning is probably one of the most crucial things that we can do. And that care plan can include crisis services, but it can also include a number of different strategies and plans and agencies and organisations and professionals to be able to work with these families and these young people. It all depends on what they need, really. And that's what we almost celebrate within CAMS, is we have a very needs-led service. So, each child is very different, and we take them their differences, and it's a very child-centred view and that whole person view. But those care plans are really crucial for us, and that kind of onward care is really important for those families.
And have you found that children and young people, are there any specific issues that you're finding a trend that people are calling about?
I mean, there's been a significant rise in the rates of children and young people presenting with eating disorders. And there's also a significant demand currently for those children presenting in crisis or with complex presentations, if you like, who have also a diagnosis of a neurodevelopmental disorder. So we're seeing the prevalence of that across our places currently. And that's why it's really important within the model that we've got currently within the CAMS response team, is it's a full multidisciplinary team. So we have nurses, social workers, support workers, therapeutic staff, psychiatry, as well as clinical leaders. And it's really important that that full MDT considers those holistic needs of that child and looks at what those care plans need to be, and whether that is just a Merseycare care plan, or whether actually we look to include children's social care or early help or our other colleagues across different organisations.
That's Lisa Simpson, the Clinical Services Manager for Children's and Young People's Mental Health at Merseycare.